Hi, this video is to demonstrate how to do a PICC line flush, and today we have a patient who has a double lumen closed-ended PICC line. You can see that there are no clamps on the PICC line, and we're simply going to flush it. So we're going to perform hand hygiene, and we're going to position the patient in the bed with their arm next to them. We're going to don our clean gloves. And we do not need heparin in this case. We're simply going to flush it with saline. You're going to flush your PICC line as per your hospital protocol. And we're going to flush it Q12 in this case, and also we're going to flush it before we give a medication and after we give a medication or fluids. We're going to use a 10 cc pre-filled syringe. We're going to start with either lumen, it makes no difference. Wrap around your SoluPrep swab and you're going to swab it for 15 seconds. We'll say that's 15 seconds there. And once you swab it, you don't want to let go because you don't want to contaminate it. You're going to connect your pre-filled 10 cc syringe, and then you're going to aspirate gently for blood, and you want to be able to see blood here in the lumen. You don't want to have blood all the way up into your syringe, so very slowly, and as you can see, we have flash blood there. So then I'm going to flip my syringe up in case there is any air. I'm going to give it a quick little tap so that all the air will sit at the top of the plunger and not go into the patient. And I'm simply going to flush now using a pulsing pressure flush. And I'm going to give the entire 10 cc's, and as I'm flushing, I'm checking that the line is patent. I'm looking for no signs of resistance or pain, no leaking or swelling, and I do have a small air bubble at the plunger, so I'm not going to give the entire 10 cc's. I'm going to stop there. I am going to leave it attached so that I will remember which lumen I have flushed. Next, I'm going to flush the other lumen with saline. So again, I'm going to swab my cap for 15 seconds. And we'll say that's 15 seconds there. You want to use, again, a 10 cc syringe. And you're going to make sure to get all the air out of your syringe. And you're going to connect to your cap, push and turn clockwise, and again you want to pull back slightly so that you can see blood in the lumen. Blood does confirm placement of the line and vasculature, and just slightly, and we do see blood there, as you can see. So we are going to flip our syringe up 90 degrees, and we again are going to flush using that pulsing pressure flush. Okay, and there should be no resistance and no issue for the patient. And again, I do have a small little bubble at the top of my plunger, so I'm going to stop there. Then now I am finished. Again, there is no clamps and the line does not need heparin following the saline, so I'm done. I can go ahead and disconnect my syringes, and then I am going to simply chart that I have flushed my line. And for troubleshooting, if you are having difficulties, sorry, grab that cap out of the way. If you are having difficulties getting blood back when you aspirate the lumen, then there are some troubleshooting tips that you can do. First of all, if you position the patient's arm to 90 degrees from their body, that will often help because that was the position that their arm was in when the PICC line was inserted. You can try that. The second troubleshooting tip would be to put the patient's bed all the way down. The head of their bed as flat as they can tolerate it, and then try to pull back, aspirate blood again. That could work. That brings the arm to the level of the heart. The third trick is to have the patient cough, and coughing increases the negative thoracic pressure, and again, this can help getting blood back. Your last trick to try is to change the caps on the PICC line itself, and we will go over cap change in the next video. And that's it. That's how you are going to flush a closed-ended PICC line catheter. Thank you.